The United States government has said their citizens having Ebola should not step into their land because of the danger of any possible mishandling that can wipe the entire population of the United States of America. Then the United States of America have said, look for some country somewhere where we can take these people because we don't want them in our own. Woe unto us that the country has been identified as to where people with Ebola can be taken for quarantine, so that if something goes wrong, it doesn't go wrong in the United States, it is Kenya. We want to say this is wrong. We have nothing against the United States, but we are also a responsible country. If the US is saying this Ebola thing is so serious, we don't want our own citizens brought here because of the danger of any spread. It cannot be that Kenya, we are so good, we are so magnanimous, that we are willing to take the risk that the United States is not willing to take. I want to say this is wrong, and I want to agree with the High Court of Kenya, who have issued a conservatory order stopping the establishment of an Ebola center within the Republic of Kenya. I want, with a lot of tremendous respect to the United States of America, the United States of America is the greatest, largest democracy. We admire their democracy and their observance of the rule of law and constitutionalism. We learn from the United States. We are not yet there. We would like to be like the United States in matters of democracy and the observance of the rule of law. I want to ask the United States of America, since there is a court order stopping the establishment of that center in Kenya, show us a way in observing the rule of law. Don't join Kenya in disobeying a court order and practicing impunity. You will be taking us back. We will be wondering whether you have two standards, one for America, that is a democratic country that observes the rule of law, respects court order, but in Kenya, you can join the Kenyan government in impunity to disregard a court order. Because I'm told, despite the court order, equipment are being brought to Nyanyuki. And Dr. Kalonzo Musyoka, what is worrisome is that members of the military who are not political, our military is very disciplined, is very professional. They have looked for me and they are telling us, speak for us. We don't want that center in Nyanyuki Air Base because we also live there. We have families. Anything can go wrong and we need to leave. So the soldiers are very unhappy, but they have no voice. The people of Laikipia, Dr. Kalonzo, Eugene Wamalo, have asked us to hold a meeting in Nyanyuki to give them an opportunity for public participation so that they can express themselves, so that the American government can know what the people of Laikipia feel. Because any decision that can affect people's lives, our Constitution provides there must be public participation. The people of Laikipia were not consulted. The people of Kenya were not consulted. So I think in the course of the week, we'll organize a big public meeting in Nyanyuki, in Laikipia, to give the residents of that county an opportunity to express themselves as to how they feel and the danger that they see. I've just seen a report from the World Health Organization this morning saying that this Ebola outbreak that has come in DRC is the type that has no vaccine. And you need 6 months to develop a vaccine. That report is also saying that in case of spread, 50% of those infected are not likely to make it. We cannot therefore endanger our country. And we are saying we have no problem assisting other countries, but we cannot assist them in what themselves they are evading. Ama siko namna hiyo? Si Amerika wanasema wanaogopa hiyo ugonjwa. Sasa kama hao wanaogopa, and we are also asking, a question has been asked to me this morning. If America are not sure they can handle that outbreak, what about Kenya, where we are unable to handle malaria? What about Kenya, where we have no equipment to deal with kidney failure? What about Kenya, where SHA is not working? What about Kenya, where there are no drugs? If America, the way it is established, they have the best working health system in the world, to an extent that medical equipment in America, even hospital beds and other equipment like MRI scanners, they only keep them 2 years. They discard them, they get new equipment. If they are that advanced and they lack confidence that they can handle that Ebola, what about our country here? Na zile shida tuko nazo. Hata hapa Kenyatta National Hospital gloves hakuna. Hata GV inakosekana. Hata chakula ya wagonjwa hakuna. Sasa Ebola mtawezana naye?